Hi, I'm Jen with New Cell Regenerative Health, talking to you today about neurostimulation treatment, specifically how to have it fully covered by your insurance and what are the steps. Number one, schedule your telehealth. If you haven't scheduled your telehealth, it's free, it's 30 minutes, and it's with our medical staff. We need you to schedule that. It's required, and it's the first step. Information is linked below on how to schedule that, a phone number or an email. Number two, we need your medical records. If you don't have access to your medical records through a portal, then we'll send you a medical release form that you sign, and we will do that work for you. What are we looking for in order to have you pre-qualified? We are looking for a minimum of 3 visits to your healthcare provider, or 3 treatments minimum, for chronic pain or complaints of chronic pain, and these need to be in the last 3 to 18 months. Dawn can give you specifics on it. She is our expert on staff. Not only is she our expert, but she's #1 in the state at achieving pre-authorization approval. So let us do our job and let Dawn do her job well. There's no point in contacting your health insurance company. The procedure for a medical practice to obtain qualification on your behalf is completely different than the insured just calling and asking if something is approved. So let us handle that. Number 3, we need photocopies of your photo ID, which would be your driver's license, front and back, and we need photocopies or a picture from your cell phone of your insurance card, front and back. These are, so that's 1, schedule your telehealth. 2, we need your medical records. Either you send them to us or we will get them for you. 3, submit copies of your insurance card and your driver's license, front and back. Then Dawn will put together a proposal and she sends it through for pre-authorization. Once you're approved, you can expect 2 appointments. They're very short. They're about 20 minutes each, 1 appointment for install of the device behind the ear, and about 10 to 12 days later, the second appointment for removal. The next step you want to keep in mind is if your insurance coverage covers 2 to 4 treatments a year, which most of them do, please do them. The results are cumulative. So my personal tip 1 is repeat, okay? Come back again in your 3 to 6 months later and have a second treatment. You will have even better results. My second tip is keep the device on for the full 10 to 12 days. Even if you walk out pain-free at the time of treatment, which is not guaranteed, but sometimes it happens, we need the full 10 to 12 days of this device interacting where it's attached. So please keep the device on for the full 10 to 12 days, even if you're already pain-free. Things that you want to keep in mind. No pacemakers. So if a patient has a pacemaker, I'm sorry, we can't treat you. Also, if you're pregnant, we can't treat you. If you have a hearing aid, we just need to remove the hearing aid on the side that you request the treatment. And some people pick this side or this side, depends on how they sleep. But that's the hearing aid. And if you have, that's the hearing aid that would need to be removed. And if you have a permanent embedded device, we need it turned off during this 10 to 12 days. But yes, we can still treat you. And a permanent device is usually treating chronic pain in one certain location. This device is treating chronic pain body-wide. So there is an advantage to that. Home care visits, yes, we do them in certain situations. If you're homebound or for any other reason, we will come to you. Treatment locations, we treat in the Philadelphia area and in Western Pennsylvania in the Erie, Pittsburgh area. So you have 2 treatment locations in the state of Pennsylvania that we can treat you. What types of insurances are going to pay for this? Well, Medicare is very cooperative. Workers' comp as well, and the major insurances in the state of Pennsylvania, Blue Cross, Blue Shield, Highmark, Aetna, United Health. Just ask us and we can look into whether your insurance is covering this. We do seminars and webinars on this pretty frequently. You want to look at our website and see what is approved, what is set up and scheduled, and qualifying conditions. So this is a big list, and it falls under the category of chronic pain, especially fibromyalgia, neuropathy, any pain that is being treated with opioids or narcotics is considered chronic pain and is likely something that we would have great success at having the treatment approved for. Positive side effects that are not standalone qualifiers, but you will see the results. You could see the results, other results in addition to your pain alleviation. Insomnia treated, dependence or cravings for not just opioids, but smoking and food and things like this. So it's a great time to dial down on your pain medications or quit smoking, something like that. Anxiety relieved, depression relieved, OCD symptoms, migraine. The list is tremendous, and I recommend you look on our website. We have a lot of information on the website, and again, check for seminars and webinars on our website. Good luck, and contact us